8,658 new cases. Overall, we have 130,000 people who tested positive, 16,000 people in our hospital system, 13,000 people have been discharged. Number of deaths are up once again. Number of people we lost, number of New Yorkers, 4,758. Which is up from 159, but which is effectively flat for 2 days. Total number of hospitalizations are down. The ICU admissions are down, and the daily intubations are down. Those are all good signs. And Jim, if you want to just take a moment and speak about the projection models here, please.
We first saw at the beginning of this was at least 100, up to 110,000 beds for COVID patients alone. And the peak would come at the end of April. Those were some of the earliest modeling from many organizations, that it would be at the end of April, around 110,000 beds just for COVID patients. There are other models, too, that we were tracking, one being lower at about 55,000 COVID beds, but again, peaking at the end of April. We follow now that we have a pretty robust data set to go by for the last several weeks. The bottom line there, the purple line, is sort of where we are tracking today, which suggests it's a little lower. And the question was, what could you do to lower those initial projections from 110,000 and from 55,000? So what activities and actions could you take to aggressively lower that overall number? And the answer really was, and what the governor has been doing, was aggressively enforce and enact social distancing to lower the overall number. And this number and the current data suggest that that is exactly what's happening. And it's not settled yet, because we are going day by day, and the numbers, as the governor says, has changed a lot over the time based on what numbers come in. But this could suggest that we are indeed potentially at the apex, or beginning to be at the apex at this moment.
And if we are plateauing, it's because social distancing is working. So we have to make sure the social distancing actually continues. On the relieving the pressure on the hospital system, and we're shifting among the hospitals, ventilators, PPE equipment, who has gowns, who has masks, and that happens on a daily basis, that adjustment. Also, to relieve pressure on the hospital system, the Javits coming online is a very big deal. That is the relief valve for the entire downstate system. Second, the United States Navy ship Comfort. The original plan was that would come in for non-COVID people. As it turned out, there's not a lot of non-COVID people in the hospital system. I'm going to call the president this afternoon and ask him to shift the Comfort from non-COVID to COVID. Northwell Health is going to help us manage those, but they're going to be staffed by military personnel. This is an enemy that we have underestimated from day one, and we have paid the price dearly. Well, the numbers look like they may be turning. Yay, it's over. No, it's not. And other places have made that mistake. Hong Kong has made that mistake. South Korea has made that mistake. And we're not going to make that mistake. And people, especially in New York City, the level of activity is up. Partially the weather made it a nice day. I understand people have been locked up for a long time, but now is not the time to be lax, and it is a mistake. So we're going to increase the potential maximum fine from $500 to $1,000, but it's not really about the fine. Nobody wants the money. We want the compliance. We are serious. And again, if it's not about your life, you don't have the right to risk someone else's life. We're also going to set up a fund run by the Department of Health to assist the healthcare workers with expenses, costs, childcare, etc. I want to thank Blackstone for making the first contribution to that fund of $10 million. And the mental health aspect of it is very real. Headspace is going to partner with New York. They're an app. They're going to have content for New York and free membership for New York, so we thank them. But we also have an emotional support hotline. We have thousands of mental health professionals who have signed up to volunteer to provide mental health services, so we want people to make sure they know about that and it's available.
Drug trial of hydroxychloroquine and chlorine going.
We've allowed usage of the hydroxychloroquine with the zithromycin pack in hospitals at their discretion. The federal government is going to increase the supply to New York pharmacies. We had a 14-day limit on how much you could buy because so many people were trying to buy it. If the federal government increases the supply to New York, which they say they're going to do, then we could lift the 14-day limit. There are a lot of people who rely on this, who were relying on it, people with lupus, etc. The tests in the hospital, they won't say that they're too short a period of time to get a scientific report. You know, hospital administrators, doctors want to have a significant data set before they give a formal opinion. Anecdotally, you'll get suggestions that it has been effective, but we don't have any official data yet from a hospital or a quote-unquote study.